Hi, this is Brian Schiff with Functionally Fit. In this column, I'm going to review a scapular warm-up series or activation series. 3 different exercises that I like to use as a preparatory warm-up or activation strengthening set prior to overhead activity or higher level lifting. Work with a lot of overhead athletes, baseball players, pitchers, you name it, and a lot of people that want to do overhead lifts who may have scapular asymmetry or weakness. And so I think it's important that we turn the muscles on prior to a higher throw or a heavy overhead lift or whatever kind of multi-joint movement they may want to do. So identifying those things and then giving them some correctives and some warm-up type exercises is a great way to prep them for success. So I'll show you 3 different exercises. We often refer to these as I's, T's, and Y's in the rehab world. You may be familiar with that terminology as well. Really what we're trying to do is activate scapular stabilizers as well as work some rotator cuff strengthening. So these are great for your active lifter, your CrossFit athlete, your overhead athlete, as well as your desk jockeys who may have poor posture and really just need to work on that posterior side and work on better alignment. So we'll start, if they're able, we'll put them up on top of the stability ball. We'll do feet shoulder width apart. We'll get the chest over the ball, and then I want to tell them that we're going to tuck the chin. Rather than have a forward head position looking out, I want them to kind of retract the cervical spine so that we're in a nice alignment as we're looking down toward the floor. We'll start with our eyes first. Palms are down, and it's a small movement, but we'll just kind of lift. We'll squeeze the top and come back down. Next movement, we come out for prone horizontal abduction. It can be done with the palms down or thumbs up. So I'll show you a rep either way. And then our final movement will be a lower trap raise. 45-degree angle, again, can be done palms down or thumbs up. So 3 really simple movements. We want to focus on fluid controlled motion, work through their available range of motion. There may be a little asymmetry, that's not abnormal to see that. We can cue them with visual cueing, tactile feedback, really make sure that they're activating appropriately. We want to make sure that they're lowering down and control. That eccentric phase is key. And then we can add a little bit of load if it's easy, maybe some light dumbbells. But I'll cycle these as part of a warm-up series before we do any kind of heavier lifting, or it can be used even prior to athletic work. They may not have a ball, but you can see this can be done simply in your own home as I'm doing it now. I've got a son who's a thrower and we like to do some arm care. But these are great things to do as far as preparatory work. They can be done as in-season maintenance work. It's good for prehab. We use it in the clinic for rehab as well. But a really simple way to kind of attack scapular stabilizers, strengthen the rotator cuff, and then improve posture for those people that are working desk jobs all the time and may be hunched forward with rounded shoulders and a forward head. So I think the ball is really nice, allows them to do both arms at the same time. They can work on a little bit of stability. If balance is an issue, we'll simply regress the exercise by having them go down on the knees, and they can just lean over the ball and do it that way. Balls are obviously available in sizes ranging from 45 all the way to 75 centimeters, and you can pick the appropriate one for your client. So again, nice easy way to attack those shoulders and prepare for better movement and higher quality activity. And then also it's great for injury prevention. So really easy tool to put in your toolbox.